Hi guys, it's Nicole. So it has been over 13 months since my gastric bypass surgery. I've lost over 110 pounds, and I recently went and had a consult with a plastic surgeon so we could discuss some, problem areas, and so that I could see how much it would cost me to fix some of these areas and what the recovery time would be, and if it would be something that I'd even be considering. So I know I was really nervous to go. I've never really ventured into the realm of plastics before. So yeah, I didn't really know what to expect. I thought maybe it would be valuable for some of you for me to share with you my experience so that you can know if you're going to seek out a plastics consult what all that entails and what at least my experience was, so that you can maybe prepare yourself. The plastic surgeon I went and saw is a very reputable plastic surgeon in my area. In fact, I worked for a neurosurgeon, and she was the plastic surgeon that we would always refer patients to when we had patients that needed some kind of repair. My bariatric team referred me to her, and they said, please only see her. She's the one we trust the most. She's just a really great surgeon. So she has a lot of clientele, so it took a long time to get in to see her. My bariatrics team recommended that I put in a request for an appointment at my 6-month visit, my 6-month post-op from gastric bypass. And I thought, oh, that's too soon. I still have a lot of weight to go. They're like, no, you need to schedule the appointment now. Glad they told me that, because it did take 6 months. Well, actually, almost 7 months to get in to see her. And I took the first available appointment. So yeah, there was quite a wait. It could be different in your situation, but mine was a no-fee consult. So it didn't cost me anything to go see her and just talk to her about what could be done. So when I got to the hospital, to the clinic that she's in, it was very standard. They weighed me first, and then I had to put on a gown. They did my vitals. They had me put on a gown. They didn't really tell me what I should be taking off, so I took off everything but my underwear. I figured I wish I could see everything. I don't know. But anyway, she had a medical student with her, and first the medical student came in and got some information from me and asked me what my concerns were, and I basically said all over. I'd like to talk about everything, head to toe. But she asked me what maybe my top 3 concerns were for the appointment. So we actually talked about 4 areas. I'll tell you about those. We talked about 2 in detail. So those areas I'll give you price breakdown and whatnot. And then when the doctor came in, she asked me what my biggest concern was. And I told her that it was my chin. So this area right here, you can see it on camera. Hey guys, it's Nicole. So I'm editing, and I just wanted to make a couple of quick notes. First, I keep saying chin when I mean neck. This is my neck, not my chin. Sorry, basic anatomy has seemed to escape me. But I also want to mention that it's okay if for the remainder of this video, you only look at my neck. Because every time I have watched this video, all I would do now is watch my neck. I just put so much of an emphasis on it up front that it's all I could look at the rest of the video. So I understand if you are also experiencing that. Okay, back to the video. I can see it. I see it every time I look in the mirror. Like, it is the thing I am most self-conscious about. And she was like, and I find most people do this when I bring up my chin. They're just looking at it like, I don't really see anything. Like, are you kidding? It's like, look at this. Like, okay. Yeah, see? Oh, that's terrible. I hate it. Hate it. But she told me that the surgery would involve making cuts around my ears, and so there would be scars around my ears, and then, pulling, and she said it wouldn't be that dramatic of a difference. You would notice the scars a lot more than you probably notice the neck right now, which I don't know if I agree with that. But she told me that it's probably best to stick to like retinol creams and whatnot for right now. She said maybe in 10 to 15 years it would make more sense to do a surgery on the neck, but right now it's just not bad enough to really warrant surgery. The scars there just wouldn't be enough payoff to account for the scars that it would then create. So anyway, we're not doing anything about the chin. I'll have to see about creams, or just get over it. I don't know. Then my next area of concern was my arms. So I don't know if you've seen my 1-year follow-up video where I wore a swimsuit and showed you guys my problem areas. I'll put some video up here. But yeah, my arm skin, you know, I do have a lot of saggy underarm skin. She looked at it and she was pleasantly surprised by my muscle tone, so that felt good. But she said that, well, here, I'll just take my sweater off here. Okay, so she said, so here's my saggy underarm. She said that she would need to make a cut from about my elbow to my armpit and then tighten the skin up, like fold the skin up, right? But she said that I would have a scar from my elbow to my armpit. She said the first 3 months or so, like that scar would be red and angry. I mean, well, first, of course, it would just be an incision, not even a scar, but it would just be red and angry. She said, you know, it would then progress and get a little less angry looking over time, depending on how a person scars. Depends on long term what that scar is going to look like. My scars tend to flatten out and become white. And so she said maybe after a year, the scar would take on, you know, my more characteristic scar appearance. So be more flat and be more white, but it would still be there. And she said, you know, of course, if you have your arms at your side, it's not going to be very noticeable, the scar. But if I have my arms at my side right now, my underarm skin isn't very noticeable. So I don't know, you know, it's a trade-off. It's what's worse, the skin or the scar. So the cost to do that surgery on both arms, it's called brachioplasty, it would be $6,127. So she did mention that, so I work for the hospital that this would be done at, and she did mention there's a small employee discount. I didn't get like an itemized breakdown, so I don't know how much that discount is, but I don't think it's very much. But yeah, $6,127 is what it would cost. Of course, I'd be on lifting restrictions for 6 weeks or so. She said that in the armpit area, that incision has a tendency to reopen because you're, you know, moving and it's in like a moist area, and it's just not the most conducive to, you know, you can't really just not move your arm, so you're constantly moving there and the skin's being pulled, and so that tends to open up. To some, you know, there's a higher risk for infection, especially in that area for those reasons. I have some issues with antibiotics already, a lot of allergies. And so there are a lot of factors to consider. And then just like, I mean, I hate that saggy skin, but I don't know if I hate it enough to pay over $6,000 and have all of those restrictions and a big scar. And I mean, there's a chance that the scar could heal in a more ropey fashion than my scars usually heal. It could heal and, you know, stay red and never, you know, fade. And so, yeah, there's a lot to consider. So I don't think I'm going to pursue that surgery at this time. Oh, I will say that when she was looking at my arms, she was very aware of my modesty. I don't know. She was very aware of the fact that most people are modest. I don't know. Again, let me mention that I'm a nurse, but I tend to have no modesty when I'm at the doctor's office. I'm just like, look at me, you know, wherever you need to look, that's cool. And so, but she was very concerned, you know, she was like, okay, one arm out of the gown at a time. And yeah, she was really, really great about that. And then we moved on to talk about the abdomen. So I have a bit of a pannus, and I know that that insurance will sometimes pay for the panelectomy. Is that what it is called? It always sounds weird when I say it out loud. I think that's what it's called. Panelectomy. Anyway, but abdominoplasty is the actual term for like a tummy tuck surgery. But some surgeries, I mean, some insurance companies will pay to have the pannus removed. That's the flap that hangs down. If it's like rubbing and, you know, causing rashes. I'm very conscientious of that possibility. I, as a nurse, have taken care of many people that have had skin fold infections and rashes, and just, they smell horrible, they look horrible, I'm sure they feel horrible. So I'm just very mindful of keeping things clean and dry and good. But, you know, I did mention I'm worried about that, and I'm pretty sure if I were to not be so vigilant, that would happen. But anyway, the doctor, she looked at it and she said the insurance company would laugh at us if we tried to submit this as an insuranceable item because your pannus just doesn't hang low enough. And it's not as bad. So, okay. There would be a big incision along my bikini line, like along the underwear line, and it would go pretty much from hip to hip, but be hidden by underwear or swimsuit or whatnot. She would pull, so, you know, if this is my abdomen and there's my belly button, like, it would get pulled down and I wouldn't have a belly button anymore. Seems weird, but like, I have a piercing from when I was 16. I got my belly button pierced. There has not been a piercing in that for over 20 years, but for some reason it remains. But she said that piercing would move from here to like the top of my pubic area. And so she would have to make another little incision to kind of get that out because, well, I don't want that. That would be weird. So yeah, I'd have that little scar as well. But it wouldn't be much at all. The recovery for that is much, much more demanding than the arms, in that I'd have to have drains placed, 2 drains. One would probably come out after a week. The other one would probably come out after 2 weeks. But the big risk in that area, you know, of course, is infection and there's a higher chance of fluid accumulation after the surgery in that area. So the drains might have to be placed again. So she felt on my abdominal muscles and said she didn't feel much separation, but she said in cases of obesity, those muscles do kind of get pushed apart. And so she would go in and just tighten up the muscles, and that can cause a lot of post-op pain as those muscles heal and come together. And yeah, she said it would be, you know, it's again like another 6 weeks or so of very limited activity. She said that she wouldn't want me traveling for at least 3 months. And, you know, I have my big plans to travel the world coming up here shortly, so that would really delay things. But yeah, so I would really like to have a tummy tuck. But then nobody's really seeing my tummy. I can wear full piece bathing suits. Like, it's not a huge deal. So the cost on that would be $7,959. So just under $8,000. Much better than I was thinking it would be. I thought it would be like closer to like $13,000. So, but yeah, I just don't think there's enough of a payoff for me to get it done. It doesn't bother me enough. I think of what $8,000 can do, like travel-wise, and I'd rather get those travel experiences than have a flat tummy at this time. Like if I were to have some kind of windfall, then yeah, sign me up. I will do that surgery. But at this time, no. Now, both of those surgeries would probably take, she said, about 2.5 to 3 hours. The max surgery time she can do at once, I think, is 5.5 hours, she said. So she said she could do these 2 surgeries together. And I got a quote for the 2 surgeries, the arms and the abdomen together, and they were $12,986. So I'd save just over $1,000 by doing them together. But that recovery would suck. I can't even imagine not being able to use your arms or your, you know, because if you get the tummy tuck, you can't really use your abdominal muscles for a few weeks, so you're like pushing a lot, like with your arms. Anyway, that would be a nightmare to recover from, but I could do them together. And then we talked about my legs. So I have some loose skin on my inner thighs, as well as some loose skin that hangs over my knees. It bothers me, but not too bad. So that's why we didn't really delve into it too much. But she did say there's a surgery they can do. Again, there would be a scar from my groin to my knee. So kind of like, you know, on the arms, from the elbow to the armpit. This would be from groin to knee. Again, considerations about how the scars are going to heal. And what they would look like. It would take time for them to fade into what they're going to become, and then who knows what that end result's going to be. And then she said that there's very little that they can do for the hooded skin over the kneecap. She said she can, do some gathering, dog earring. I can't remember what she said. I can't remember the term she used now. But there's like, she could do some gathering at the knee, kind of move it over. But she said it just, your knee is bending so much and like it's, a big area to bend, that there's just really no surgery that, you don't want to make the skin too tight there because the knee's not going to bend. So yeah, it's complicated there. She said they could do a little bit of liposuction and get the remaining fat out of there, and that might cause the area to shrink a little more. But really, yeah, not really any good options. I didn't even get a price quote on that one because, my inner thighs aren't bad enough really to pursue, and the hooded part of the knee is really what bothers me, and there's just really not much to be done about it. So areas that we didn't discuss, my rear end. So like, I'm sure I could do some kind of like Brazilian butt lift, or what do they call them? Is that what it's called? That Brazilian butt lift? Is that what it's called? Something, the Kardashian surgery where they plump it up. I'm sure I could do that, but I'm not going to do that. Of course, they're the breasts, but they don't bother me, whatever. I don't mind having, being part of the itty bitty, committee. It's fine. It's fine. There's some hanging skin under my armpits, loose skin there, but that would I'd probably just need a breast augmentation, and I don't feel the need for that. So yeah, that was my experience at the plastic surgeon's office. She was amazing. She made me feel very comfortable. All of her staff was really great. And in the future, maybe this is something that I would pursue, but right now it's just not. Like, there are definitely parts of my body that I wish looked different. Oh, this neck. But yeah, at the end of the day, I'm pretty happy with where I'm at. Clothes can do a lot to camouflage. Spanks are tremendous. Nothing is slowing me down. Nothing is a necessity to get taken care of when it comes to skin. I'm not on a quest for perfection. I'm doing my best, and I don't feel like plastic surgery is necessary right now to help me meet my goals and to get what I need out of life at this time. So anyway, well, thanks for watching. I hope it was an informational video and that you got some good insight into the whole plastics consult process if you didn't have that before. But check out my other videos if you're interested. Like, subscribe, leave a comment, and I will catch you guys in the next video. Thank you. Bye.